So first off, thank you so much for your willingness to share about cardiac rehab. My name is Arlene Ford Bond. I am part of the National Association of Business Women. I'm also part of Promedica, and I'm also part of cardiac rehab. So I just wanted to, during this presentation, I wanted to share ways to decrease risk factors associated with heart disease. I also wanted to share two different kinds of risk factors. And we know that some are modifiable, meaning that we can change them, and some are non-modifiable, which means that we can't change them. So sometimes, unfortunately, with lifestyle changes, things that we modify, we still find ourselves in the instance where we have cardiac disease. So this may be as a result of race, age, family history, and those things that we can't change. So the first question that I have, I want you to introduce yourself and give us a little bit about how a person can get started in cardiac rehab. What's the first steps?
Hi, I'm Robbie. I'm one of the exercise therapists with Promedica Flower Hospital Cardiac Rehab. And as far as getting started with cardiac rehab, one of the first things we're looking for is a qualifying diagnosis, be that a CABG, coronary artery bypass graft. Some people just refer to that as open heart or bypass surgery. A heart attack, having a stent placed, or being diagnosed with congestive heart failure. Those would all be qualifying diagnoses for cardiac rehab. Obviously, we don't want any of those to happen. We want to try to prevent those as much as possible. But in case they do, in most cases, the person is hospitalized. They're receiving treatment as well as education in the hospital about how to proceed after their discharge from the hospital. And then from there, their doctor puts in an order for cardiac rehab, where we are the ones to reach out, get that person scheduled and evaluated so that they can start the program sooner rather than later and start that road to recovery.
Great. That's awesome. Thank you so much, Robbie.
Thank you.
So the next question that I have, share with us a little bit about evidence-based practice. Robbie talked about the program. So how do we know that this actually works, and how evidence-based practice is associated with cardiac rehab as far as having positive outcomes?
Hello, my name is Asusa. Everybody refers to me as Seuss. Also an exercise therapist here with Promedica Flower Cardiac Rehab. And with evidence-based practice, a lot of programs like UTMC, St. Luke's actually have physical numbers showing the benefits of cardiac rehab, with UTMC stating that it has a 30 to 35% chance of lessening your chance of going back to the hospital due to cardiac-related issues. In St. Luke's, when they're open, stating that it increases your life expectancy by an extra 5 to 10 years from your cardiac event, whether that be open heart surgery, heart attack, stent placement, et cetera, et cetera. It's a supplement to, what you had, a supplement to your open heart surgery, a supplement to the stent, a supplement to medications they may put you on to control symptoms, with exercise being another sort of medication to help increase your quality of life.
Thank you so much, Seuss. Those are really stunning numbers, and it shows the benefit of cardiac rehab. So thank you so much for that. The next question that I have is, how does the program actually work? I know Robbie told us about how to get started, and then Seuss gave us, some evidence-based practice. But if I were to sign up, like, what actually happens? How does it work?
So my name's Jacob. I'm one of the other exercise therapists here at Flower Hospital. So cardiac rehab, when you come in for the program, it's a monitored exercise program in which we'll have you on a heart monitor while you exercise, keeping track of everything, keeping an eye on you, making sure everything's nice and safe. It's a program that typically lasts 2 to 3 months, about an hour or so each time, where we do different exercises personalized to the patient. That way, nobody gets hurt, nobody gets anything wrong or worse with them. We mix in weight training, strength training, flexibility. So it's all kinds of different stuff. It's a gradual progression that a lot of people compare to physical therapy. So it's like you get your knee fixed, you go to physical therapy, get it better. You get your heart fixed, you go to cardiac rehab to get it better.
That was that made it plain for me, and I'm a nurse. And just hearing that like that makes it very plain. So thank you so much, Jacob. The last question that I have, actually, Sue's kind of hit on this, but just wanted to know, or it might have been Robbie, just wanted to know, a lot of people think of cardiac rehab, meaning that if you have a heart attack, but can you just reiterate some of those things that was previously shared? Is it only for heart attack patients? If not, again, just reiterate on what type of patients can even ask their physicians, because I know we talked about needing a referral and qualifying diagnosis. So if something's going on with me, how can I ask for something like cardiac rehab, even if I haven't had a heart attack?
Seuss again. So with cardiac rehab, it's based on event by event. So the event being a heart attack, whether it's a STEMI or an NSTEMI, CABG, like Robbie was saying earlier, open heart surgery, any open heart procedure, whether that's a bypass or valve procedures or valve repairs that may have gone through a catheter, whether it's through your arm or through your groin. A heart failure diagnosis is also considered an event that would consider you up for cardiac rehab or referral. So it's specifically based on those criteria that would get you the referral from your physician for cardiac rehab. And usually how it works is the physician will either put the referral in right after they do the procedure and then bring it up to them, following up with them outpatient after said procedure or said diagnosis. Hey, this is something you should look into as a supplement to these meds we put you on, as supplement to your surgery to help kind of aid in your recovery, usually like that. So it'd be those specific diagnoses that will qualify you for cardiac rehab. That's how you would get set up with everything. Usually the physicians are good at bringing it up after, all these things have happened to patients.
Okay. Well, thank you so very much, each of you, for taking time out of your day to share with our community, as this is Heart Health Month, and we want to improve the health and well-being, which is our vision and mission here at Promedica, to improve the health and well-being of our community. And we're hopeful that this presentation will do just that. So once again, thank you so much.